Hi everyone, I'm doing this post today for my friend Anna, who's having some pain in her sciatic nerve, but she's really far away, so I don't get to see her in person. So here's a video instead. The first thing that you want to remember is to stand with the outside edges of your feet pointed straight ahead. So you can actually go up, use the edge of your yoga mat, or if you have hardwood floors, you can use the lines in your floor or a yoga block, kitchen mat, go up against a wall, whatever you have to do to get this outside edge pointed straight ahead. So I'm going to go ahead and line up like that. The second thing you'll notice is that my feet are pelvis width apart. So not hip width, but pelvis width. Use your fingers and find these two bony protrusions here. That's how far apart your feet should be. You drop the plumb line, it will go in the center of your knee and just in the center of your ankle here. And then, I'm going to show you on the side here. I'm going to line up my feet, pelvis width apart, outside edges pointed straight ahead. And then I'm going to start carrying my weight in my heels when I'm standing around. Stop standing like this. As you move forward like this, you're kind of crunching all of this area here. You're compressing it, and it can get really irritated. There's not enough blood flow in the area. So we're going to not do that. Just back up your hips so that they're over your heel. It's going to give you a really vertical leg. So you're going to have a vertical leg from front on, right? If you stand with your feet too far apart, your legs are out like this, too close together, your legs are coming in. So you want a vertical leg from the front and a vertical leg from the side. None of this, all of this. So that's my first tip, is stance. Just stand like that all the time. When you're walking, start walking with the outside edges of your feet pointed straight ahead. It'll make a really big difference. I'm going to give you two exercises as well, but the way you stand and walk is going to be the biggest thing. You shouldn't have to stretch and exercise so that your body doesn't hurt. It should just work properly. So, maintaining these alignment points is going to make a really big difference. So the first exercise is called the pelvic lift, and I've got a link below the video for Katie Bowman teaching the same exercise, which is where I learned it, and hers is a little bit more in detail. So you're going to stand again in this new neutral stance, feet pelvis width apart, pointed straight ahead. If your feet turned out, this exercise is not going to work. So feet go straight ahead. You're going to shift your weight into one heel and then push down on this side. I'm not lifting with this. I'm just, hang on, see if you can see this better. See how my hip is coming up? Because I'm using this muscle right here to just pull my pelvis down so the other side comes up. And then I'm going to hold it until I'm tired, until I can't do it anymore. And you should do the same. So on the other side, if you're not feeling it, you might be too far forward. So if you need to hold on to a chair or something, that's fine. Keep your weight in the heels and keep your foot pointed straight ahead. And you should feel it all right here. The third thing, which is another exercise, is a piriformis stretch. So you're going to sit in a chair with a lumbar curve. Don't arch your back, right? Keep your back relaxed, but keep this lumbar curve. So you're going to keep your pelvis rocked forward on the chair. You're not going to sit on your tailbone for this stretch. Keep your butt bones digging into the chair. And then you're just going to pop your ankle up on your knee and just hang out there. To increase the stretch, you can rock your pelvis forward or lean forward slightly. But when you start this, it's really important that you have a right angle here. So you want your knees coming straight out from your hips. Don't flex your legs open or keep them too close together. And you want them pelvis width apart. So it's the same, those two bony parts there. It's called your ASIS. Those bony parts, that's how wide your knees should be. And then without moving this foot, you pop that leg up and then rock forward on your pelvis. You should feel a really deep stretch kind of deepen the muscle there, and that's your piriformis. So your sciatic nerve actually can run through the piriformis, and if the piriformis is really tight, it's going to cause a lot of friction on the nerve and a lot of compression on the nerve, so you can get pain there. So the piriformis stretch, number 4 stretch, do it, a few times a day. Hold it for a minute or two every time that you do it, and be gentle with yourself. It doesn't have to be really intense. You should just feel a nice stretch in there. And the pelvic lift, where you're just loading this muscle here, all of this, and you're just balancing on one foot. Don't bend your knee or do your balancing thing. Your foot is just coming up off the ground this much. Your pelvis is just shifting up like that. And then you hold it until you're tired. And then the third thing was the stance that we talked about. So feet pelvis width apart, weight always in the heels, and the outside edges of the feet, pointed straight ahead. And that's it. So good luck, Anna. I hope that your sciatic nerve is feeling better really quickly. Bye!